Hello and welcome to today's health segment.
Good day, everyone. My name is Chukupis Ozioma. I'm a community health practitioner, and in this section, I'll be taking us on pediatric diarrhea. Now, pediatric diarrhea it refers to the loss of watery stool in an infant and in a child, and it's common in the early stage of childhood. Now, there are lots of things that leads to this condition. It has a lot of causes, which I'll be listing briefly. Now, we have the viral infection, which is one of the causes. It is caused by a rotavirus. Ever heard about the name rotavirus? It's similar for mothers that goes for immunization with their children. This vaccine is given orally in the mouth to prevent what diarrhea in children. It's given at 6 weeks, at 10 weeks, and at 14 weeks during the immunization schedules. So we also have another causes which is caused by bacteria. Example of the bacteria is Salmonella and E. coli. We also have medical conditions. Some medications can actually lead to diarrhea in children, actually, like the example of using an antibiotic that doesn't really suit a child, so it can lead to that. We have food allergies, that's lactose intolerance and all that. So for these symptoms are what you see that you can suspect that this child is having what a diarrhea. Now, one of the symptoms is frequent loss of stool. That's a person or a child or the infant will be stooling frequently, and this stool most times it come in a watery form, and this happen frequently. Another one is watery or blood in stools. You see, just like what I said, watery or blood in stool, like what I said in the first one. We have abdominal pain, we have fever, there is vomiting, there is dehydration. All these things are what you will see in a child or in an infant, and you suspect that this child is having what.
How can diarrhea be treated in children?
So on the treatment aspects, there is what we call fluid replacements. Now, this fluid replacement can be done by taking in ORS or through an intravenous fluid. Now, remember I said my topic involves pediatric diarrhea and preparation of ORS. Now, let me briefly talk on how to prepare ORS before I give other treatments, other examples of treatment. Now, if you want to prepare an ORS, which is SSS, which is sugar salt solution, you get your spoon, your normal teaspoon, you measure it 6 spoons of sugar, 1 level spoon of salt. You get your water, your 75 cl water, that's your small bottle water. There's no time I would have prepared it on this clip, but I'm just telling you how to do it. So when you get your 6 spoons of sugar, your level spoon of salt, your water, and a bowl. Now you turn this water into your bowl, the 6 spoons of sugar in the same bowl of water, and a level spoon of salt, just a level spoon of salt. Then you stir until everything is being dissolved. Now the taste will be more like a coconut water. That is how it tastes. So that is how the taste is. So if you're in a place where you can access the sachet ORS, you can actually prepare this homemade salt sugar solution at home and give to your child in order to what prevent diarrhea. Now, another treatment is use of medication. That's the use of anti-diarrhea. Example of this anti-diarrhea drug is what we call loperamide. When you go to a pharmacy, you get it there, or in an hospital, it will be a part of what they'll give your child. It's called loperamide. And we also have rest and hydration. This rest could be a form of sleeping or relaxing, and the hydration talks about taking in fluid, that's taking in water and breast milk, since we're talking about infants. Now, it can also be prevented. Yes, it can be prevented. And how can you prevent it? Having a proper hygiene. Now this proper hygiene talks about frequent hand washing. Now when your child goes out to play, after using the toilet, after eating, it is wise we encourage them to wash their hand. This will help to prevent diarrhea in children. Now another one is eating habits. Now some of our child will see, after when they are eating, they start picking the ones that are falling from that's the scraps on the ground. They pick and put in their mouths. Probably the ground is not well clean, so it's nice we keep our environment clean.